So I've had a lot of people come to me recently and ask me, Dero, what are you building? What are you building? So I decided I'm going to go ahead and just document this journey with you guys. So what we're building is a tool for nurses, ICU nurses in particular, who are seeking an efficient way to deliver quality care to their patients. Why am I building this app? I think better question would be why not? Entrepreneurial spirit is something I've always had, especially after graduating college. You just kind of see how creative you are and the different ways that you have about solving solutions. And I think that comes very natural for me. So if you look at my binder, I have a list of, over 25 different ideas, but this one in particular, I actually experienced myself in a deep level. And I was like, you know what? I think that the world needs this. So this idea came about during the whole COVID pandemic. Probably about 8 months into my first year in the ICU. I was up in COVID land. COVID land is pretty much where we designated our hospital designated an entire floor to the COVID patients. All these patients were really, really sick. Probably about 80 to 90% were actually receiving mechanical ventilation. The patient that I was taking care of in particular was vented, of course. And then on top of their COVID, they also had a pneumonia and another infection, and then this along with all their other comorbidities. So they're just a really, really sick patient. So the patient had, all kinds of different infusions, 𝘼 𝘾𝙤𝙪𝙥𝙡 �vaso, sodium bicarbonate, 4 or 5 different antibiotics, receiving albumin, and just this cocktail of infusions. So I had probably 8 to 10 different pumps that were sitting outside the patient's room. And best practice tells you to, confirm your patient's infusions just for patient safety, especially at the beginning of the shift. So what makes this really complicated with the COVID patients is that you have to gown all the way up, which takes time to go in there to confirm all of these infusions. So you may have 12 different infusions going into a patient's central line, and it takes up a lot of time. So I found myself outside the room 10, 15, maybe even 20 minutes, like manually writing out. I printed off the compatibility chart that you can online. Most nurses know what I'm talking about. But then it doesn't tell you which lumen that these can go into. You have to, on a separate piece of paper, figure out what all goes together. If you're a nurse, you understand. If not, just know that this takes a long time. And I was like, you know what? Let's build a solution for this. And that's pretty much where we're at now. We've been building this app since probably about August of 2020. I thought it was going to be done at like October for testing, but there's a lot of different things that I'm learning as I'm building this. We're actually getting ready to deploy our first flight. So what we're doing now is just recording the process and getting our name out there. Really want to connect with a lot of ICU nurses and get some feedback on what we think can really revolutionize the way we deliver care.